Hello everyone. Today, we're exploring the medication Quviviq, which is a brand name for the drug daridorexant. As always, this discussion is for educational purposes only. If you have health-related questions or concerns, it's important to consult with a healthcare professional. Description: Quviviq, with the generic name daridorexant, is an oral tablet designed to treat insomnia characterized by difficulties with sleep onset and/or sleep maintenance. It belongs to a class of drugs known as dual orexin receptor antagonists. By blocking the action of orexin, a chemical messenger in the brain that regulates wakefulness, Quviviq helps to promote sleep. It is available by prescription and is intended for short-term use. Warnings: Quviviq should be used with caution. It is not recommended for patients with narcolepsy, as it may worsen the condition. Caution is also advised for those with a history of complex sleep behaviors such as sleepwalking, as Quviviq may exacerbate these behaviors. Additionally, this medication can impair daytime wakefulness, even when used as prescribed. It's important to assess the risk of morning impairment before starting Quviviq, as it may affect activities that require full alertness, such as driving. Before taking this medicine. Before starting Quviviq, inform your healthcare provider about your medical history, especially if you have a history of depression, mental illness, or suicidal thoughts. It's also important to discuss all medications you're currently taking, including prescription and over-the-counter drugs, vitamins, and herbal products, to avoid potential interactions. Pregnant or breastfeeding women should consult their healthcare provider due to potential risks to the baby. Side effects: Common side effects of Quviviq include drowsiness, headache, and fatigue. Some people may experience complex sleep behaviors such as sleepwalking, which can be dangerous. If you experience any new or worsening symptoms, such as changes in mood or behavior, depression, or suicidal thoughts, contact your healthcare provider immediately. Other serious side effects may include temporary weakness in your legs, daytime drowsiness, or feeling like you might pass out. Interactions: Quviviq can interact with other medications, which may increase the risk of side effects or reduce the effectiveness of either Quviviq or the other medication. It's crucial to discuss all medications you are taking with your healthcare provider to ensure that Quviviq is safe for you. Dosage: The recommended dose of Quviviq is determined by your healthcare provider based on your specific circumstances. It's important to follow your healthcare provider's instructions and not to take more or less than prescribed. Quviviq is usually taken once per night, 30 minutes before going to bed. Avoid: While taking Quviviq, avoid alcohol and other central nervous system depressants, as they can increase the sedative effects of the medication. Also, avoid activities that require full alertness the day after taking Quviviq if you feel drowsy. FAQ: A common question about Quviviq is whether it can be habit-forming. Quviviq has the potential for dependence and withdrawal symptoms, so it's important to use it only as prescribed by your healthcare provider. Closing: This concludes our overview of Quviviq. Remember, this information is intended to provide a general understanding of the medication and is not a substitute for professional medical advice. Always consult with a healthcare provider for any questions or concerns about your medications. Thank you for joining us.